Hi guys, my name is Vani. Here I am going to deal the topic is oral cavity. What is the oral cavity? Oral cavity is the initiating and complex part of the digestion and respiration system, facilitating the ingestion, digestion and speech and breathing. These functions maintained by the oral cavity. How many parts involving in this oral cavity means vestibule and oral cavity. In this teeth, gums, lips, then tongue, then flora of the mouth, then tonsils and salivary glands are present. Uvula also present. So here I am mainly anatomically dividing the parts is two types. First is vestibule and oral cavity. Vestibular cavity is look like a horseshoe. It is look like a horseshoe. Then it is the anterior part of the vestibule is known as lips and cheeks, and posterior part of the vestibule is known as teeth and gums. Then the lips by the skin. Then internal mucosa. It is covered by the orbicular oris and submucous labial gland. Next mucosa inside of the lips. Then it is divided by the stated squamous epithelial mucocutaneous junction. It is divided upper and lower lip divided by the mucous lips. Then upper lip vertical line is philtrum. Upper lip vertical line is philtrum. Next, inside of the upper lip is mucosal fold is present. Next, labial frenulum. Labial frenulum is attached by the gums. Two lips meet the angle. Mouth is the entrance point of GI tract. Then cheeks externally covered by the skin, internally covered by the buccinator muscles. Next, submucosal buccal glands. Next, mucus lining also inside of the cheeks present. Next, nasolabial sulcus. This line is nasolabial sulcus. Two sides of nasal to lip. This line will form now, that is called as nasolabial sulcus. The anterior part of the oral cavity is teeth and gums. Next, posterior part of the oral cavity is faces or pharynx. Next, later part of the oral cavity is present cheeks. Then roof anterior part of the oral cavity is hard palate. It is the bony prominent. The medulla bone will formed by the hard palate. Next, soft palate. Soft palate is made up of the muscle. It is superiorly present of the oral cavity and inferiorly present of oral cavity. The part is tongue and sublingual region. Then soft palate is made up of the muscle conical structure, that is called as uvula. Next, two muscle arches are extended to the tongue, that is called as palatoglossus arch. Posterior uvula nearby the pharynx, the arch will present, that is called as palatopharyngeal arch. Next, palatotransials are also present in present of both side of jaws or both side of nearby pharynx or faces. Beside of spaces, the transils also present, that is called as palatal transils. Next, oral cavity and nasal cavity separated by the spectrum, that is called as uvula. This is the anatomical structure of mouth. If you have any doubts, you can message me. I will clarify your doubts. Thank you. Please do like, share and subscribe my channel Vani Vlogs. Thank you so much.